You know, it's pretty amazing, really, when you think about it.
Mm-hmm.
Every single bite of food any animal takes, well, it kicks off this incredibly complex, usually totally seamless journey.
Right. Mouth to stomach.
Yeah, and it's a system we barely even consider most of the time.
Yeah.
Until, well,
Until something goes wrong.
exactly. And it can throw everything out of whack.
It really can. Those intricate systems are, I mean, they're marvels, but they can be surprisingly delicate. A seemingly small issue can have massive consequences.
It's true. And today, we're doing a deep dive into one of those challenges, a complex disorder called Megaesophagus. We're going to unpack this condition, specifically looking at how it affects some really interesting herbivores, camelids. So your llamas and alpacas,
Right.
and cervids, which are deer and elk.
Okay.
So our mission here is to pull out the key insights from the sources we've reviewed to give you a really clear, concise understanding. What is this condition? Why does it happen? How do vets figure it out?
And what does it really mean for the animals? So think of this deep dive as maybe your shortcut to understanding a pretty significant puzzle in animal health. We'll definitely hit some surprising facts, look at the diagnostic challenges.
The puzzle's there.
Right? And definitely explore the why it matters bit, why understanding these specific issues is important.
Okay, let's get into it then. To really grasp this, we need to start with the basics. The fundamental question, what exactly is Megaesophagus?
Okay, so first off, it's not really a single disease itself. It's better described as a disorder. Think about the esophagus, that muscular tube running from the mouth down to the stomach.
Right.
In Megaesophagus, that tube essentially loses its muscle tone. And crucially, it loses its ability to properly push food downwards.
That wave-like motion.
Exactly, peristalsis. That wave-like muscular contraction just doesn't work properly. And the result is the esophagus becomes kind of flaccid, it enlarges, and food just accumulates there instead of making it to the stomach.
So that key action, peristalsis, fails, food pools.
Okay.
And I'm guessing that pooling directly causes the main sign people see, regurgitation.
Precisely. And it's a passive expulsion of undigested stuff. This is really important. It's quite different from vomiting.
How so?
Vomiting involves active, forceful abdominal contractions. Regurgitation is more like stuff just coming back up without that effort.
Okay, and because the food isn't getting where it needs to go.
The nutrients aren't being absorbed properly. So yeah, affected animals almost inevitably suffer from chronic weight loss, muscle wasting.
Yeah, the really serious risk.
Mm-hmm.
The one vets are most concerned about.
That would be aspiration pneumonia. That's the gravest complication.
Right, when the regurgitated material gets inhaled.
Exactly,
Yeah.
into the lungs. And that, as you can imagine, can often be fatal.
Okay, so looking at causes then, big picture, where does this come from?
Well, we can generally categorize the causes into two main groups. Congenital, meaning it's present right from birth, or acquired, meaning it develops sometime later in the animal's life. But here's something really interesting and honestly often frustrating for vets.
Yeah.
A lot of the time, even after a thorough investigation, you just can't find a specific cause.
Really?
Yeah. And that leads to a diagnosis of what we call idiopathic megaesophagus, which basically just means of unknown cause.
Wow, that must be tough. For everyone involved, you know the what, but not the why.
It really is. It highlights that sometimes, even with our best tools, the root cause just stays hidden, and that directly impacts treatment, of course.
Okay, so with that foundation laid, let's zoom in on where this condition is, well, a more significant issue. Let's talk camelids, llamas, and alpacas.
Right.
It seems moderate to severe esophageal dilation is, quote, relatively common in them. Any age, any sex.
Yes, that's correct. And as we just mentioned, often the cause in camelids is idiopathic unknown. However, there's a specific thing to look for in young ones, in Crius, usually around, say, 3 to 5 months old.
Okay.
A congenital abnormality called a vascular ring anomaly, or VRA.
Vascular ring anomaly, what is that?
Basically, it's where some fetal blood vessels, which normally should disappear before or shortly after birth, they persist, and they form a tight ring around the esophagus.
So they literally constrict it, like a physical bottleneck from birth.
Exactly, physically squeezing the esophagus.
Okay, that makes sense for young ones. But what about acquired causes? You said it can happen in adults too. Are those common?
Acquired causes seem less common than idiopathic, but yes, they definitely occur. You can sort of group them. There's direct damage to the nerves or muscles of the esophagus itself, like one study mentioned organophosphate toxicity in a llama. That's a type of poisoning affecting nerves.
Okay.
Or you can have nerves just degenerating, which is called a vagal neuropathy, or the esophageal muscles themselves weakening, a degenerative myopathy.
So problems with the esophagus's own machinery.
Right. Then there are systemic diseases, body-wide problems that can affect the esophagus too. Things like an underactive thyroid hypothyroidism or adrenal problems, like Addison's disease. And then, of course, you've got your more straightforward physical issues, blockages from foreign objects, scar tissue causing strictures, tumors, even just chronic inflammation from acid reflux can potentially play a role.
Wow, okay, that's quite a range of possibilities. So given all that, how does this usually show up? What would an owner or a vet first notice in a llama or alpaca?
Well, the signs can vary a bit, but chronic weight loss or maybe just failing to grow properly, that's really common. But the absolute key sign is that postprandial regurgitation bringing up undigested food after eating.
Okay, postprandial after eating.
Right. And it's often mistaken for choking initially, which is obviously a very different acute emergency.
I see.
You might also see lots of drooling, hypersalivation, maybe excessive frothing, especially when they're trying to eat.
Okay.
And critically, signs like coughing, maybe some nasal discharge, a fever, those point directly towards that secondary aspiration pneumonia we talked about.
The lung infection.
Exactly. Sometimes you can even see weird waves moving under the skin in the neck area. That's the esophagus trying, usually unsuccessfully, to push food along.
Visible peristalsis. Wow. Okay, so diagnosis sounds like it could be a bit of a journey, given the symptoms can overlap with other things.
It can be.
What's the definitive step? How do you know it's Megaesophagus? And I wonder, are there common misdiagnoses along the way?
Yeah, it can definitely be a puzzle. A definitive diagnosis absolutely relies on imaging.
Okay.
Barium contrast radiography, basically, giving the animal barium liquid to swallow and taking x-rays or fluoroscopy, which is like a moving x-ray.
All right.
These are key. They let the vet actually see the esophagus, confirm that it's dilated, enlarged, and importantly, that it's not contracting properly. See that loss of function.
And other tools.
Endoscopy can be useful too, putting a camera down the esophagus to get a direct look inside for any structural problems, inflammation, blockages, that sort of thing.
Makes sense.
And of course, lab tests are crucial. Blood work, maybe specific tests to rule out those underlying systemic or neuromuscular diseases we mentioned.
Like the thyroid check.
Exactly. Thyroid function, adrenal function tests, maybe even an acetylcholine receptor antibody test if you suspect something like myasthenia gravis.
Why, myasthenia gravis?
Yeah.
That's an autoimmune thing affecting muscles, right?
It's precisely. The body attacks the connections between nerves and muscles, leading to weakness. It could affect the esophagus.
Okay. So once you have that diagnosis, what then? What's the outlook for these llamas and alpacas? Is there a good treatment?
Yeah, this is where it gets really challenging. Unfortunately, for the common idiopathic form in camelids, there aren't really any consistently successful medical or surgical treatments.
Oh, so what do you do?
Management is largely supportive. It's about managing the condition, not necessarily curing it.
Okay. How?
A big part is altering the diet, changing the food consistency to something easier to swallow, like a soupy slurry or a gruel.
Right, making it flow easier.
Exactly. And, critically, changing how they eat. Providing feed on a raised platform. We call it elevated or vertical feeding.
So they're eating small looking upwards.
Essentially, yes. You use gravity to help the food get down into the stomach, bypassing the esophagus's lack of motility.
Huh. That sounds simple, but maybe really effective.
It can be remarkably effective. It's a low-tech intervention, but it can make a huge difference. We've seen animals go from being quite debilitated to managing reasonably well just with careful feeding management.
Any medications help?
Sometimes. Medications called prokinetic agents, things like metoclopramide or cisapride, might be tried to encourage motility, but results are often variable. Antacids, like omeprazole, can help if there's secondary inflammation, esophagitis, from food sitting there.
Okay.
And of course, if you do find an underlying cause, like hypothyroidism, treating that primary condition is absolutely key.
Right.
And then there's the constant need to watch for and prevent aspiration pneumonia. Careful monitoring, maybe using antibiotics proactively in some cases, although that's debated.
So the overall prognosis long-term?
Generally, it's considered fair to poor for camelids with idiopathic megaesophagus. While some can be managed supportively for a decent amount of time, that ongoing risk of chronic weight loss and, crucially, fatal aspiration pneumonia, it's always there.
And for the crias, the young ones with that vascular ring anomaly?
Even with surgery to try and correct the constriction, the prognosis for Crius with VRA is usually considered grave. The damage might already be done, or the surgery itself is very high risk.
Wow, that's pretty stark. Okay, let's shift gears then. Let's pivot to the cervids, are deer and elk.
Okay.
How does Megaesophagus look in these animals? Is it the same kind of common veterinary challenge we see in camelids?
Now that's a really striking contrast.
Oh,
Megaesophagus is actually considered rare in deer, elk, and other ruminants and
really?
jugs.
So much less common.
Much less common. A lot of what we understand or think we understand about it in cervids is actually extrapolated from other species, or it's based on just a few isolated case reports here and there. It's just not seen very often.
Interesting. So given that it's rare, do we know much about the causes? Are they similar to camelids, or is it a different picture for deer and elk?
Well, there are some potential overlaps. Congenital causes can happen, including those vascular ring anomalies we discussed.
Like the PRAA?
Exactly. Persistent right aortic arch, PRAA. That has been documented specifically in newborn whitetail deer, causing that esophageal compression and leading to megaesophagus secondarily.
Okay. What about acquired causes in adult deer or elk?
Acquired megaesophagus in adult ruminants, including cervids, seems quite rare overall. If it does happen, potential causes could include things like trauma, maybe to the throat area, the pharynx, or esophageal obstruction again, foreign bodies, tumors, or damage to the vagus nerve. This nerve is really important for digestion in ruminants. Damage can lead to something called vagal indigestion syndrome, which affects stomach motility and could potentially impact the esophagus.
Okay.
In sheep and goats, there's also mention of segmental muscle necrosis patches of muscle in the esophagus dying off. But idiopathic megaesophagus, the unknown cause type that's common in camelids, that seems to be rarely reported in cervids.
So a different pattern of causes, it seems. What about the signs? If a deer or elk did have this, what would it look like? Similar to llamas?
Yes, the clinical presentation seems pretty similar across species when it does occur. You'd primarily be looking for regurgitation, weight loss,
Right.
and then those telltale signs of aspiration pneumonia if it's developed, coughing, fever, maybe nasal discharge, difficulty breathing.
And diagnosis
Yeah.
still relies on imaging.
Pretty much the same approach, yes.
Yeah.
Confirmation usually comes from imaging. Radiography X-rays can show that classic dilated esophagus, often filled with air or fluid. Contrast studies, using barium again, are really helpful for outlining the esophagus properly and spotting any specific obstructions or strictures.
Makes sense.
Endoscopy allows for that direct look inside for abnormalities or inflammation. And lab tests would be used to check for any underlying systemic issues, just like in other species.
Okay. Now, treatment for cervids. I imagine this is where things get really complicated, especially for wild animals.
Absolutely. For wild deer or elk populations, treatment is generally just not feasible.
Yeah, I figured. The logistics.
Exactly. Capturing, providing ongoing supportive care, elevated feeding multiple times a day. It's just not practical in a wild setting.
But what about captive deer or elk? Say, in a sanctuary or zoo?
For captive animals, yes, management strategies would mirror what we do for other species. Supportive care is the mainstay, so things like elevated feeding, modifying the food consistency to make it easier to swallow, possibly trying those prokinetic agents or antacids.
Okay.
And if, say, an endoscope revealed a specific obstruction that could be fixed, surgery might be an option in a captive setting, sure.
Right. And the overall prognosis for cervids, if they're diagnosed?
Generally poor, unfortunately. Again, it comes down to that high risk of chronic malnutrition and especially fatal aspiration pneumonia.
Same core problems.
Exactly. Maybe in very mild cases, careful dietary management might allow an animal to cope for a while, but severe cases definitely carry a guarded prognosis.
Okay, so let's try and recap this deep dive then. Megaesophagus. It's clearly a debilitating condition. It impacts both camelids and cervids, but it's much more commonly diagnosed in llamas and alpacas.
That's right. And the cause is often idiopathic, that frustrating unknown, which makes treatment really challenging and heavily reliant on supportive care, managing the symptoms.
A key thing that is similar, though, especially in young animals from both groups,
is that congenital vascular ring anomalies are an important possibility to consider, a key differential diagnosis.
Right. And regardless of the cause, the main goal of management seems to be modifying how they eat.
Yep. Changing feeding practices to help gravity do the work, get food down, and critically minimizing that ever-present danger of aspiration pneumonia.
And sadly, the long-term outlook, whether we're talking camelids or cervids, generally remains guarded to poor.
It really does. which absolutely highlights the need for more research, especially in camelids where it's more common. We need to better understand why it happens, the underlying causes, so we can hopefully develop more effective ways to treat it.
Definitely. This whole deep dive into Megaesophagus, it really hammers home how delicate these physiological systems are, even something that seems as simple as swallowing.
Mm. It's incredibly complex when you look under the hood.
Yeah, it kind of makes you wonder, doesn't it? What other hidden biological challenges are out there, just waiting for us to understand them better, maybe through a deep dive into what seems like an obscure topic.
It's a great thought. There's always more to uncover.
Something for you all to ponder.